As we progress through the 21st century, the role of the nurse continues to expand. The increasing reliance on technology in nursing education and practice, the pressures of healthcare reform, and the continuing crisis of non-insured or underinsured personas have combined to make nursing practice more complex than ever. The nursing profession has developed a reputation for successfully delivering high-quality, cost-effective care. In fact, a survey of public attitudes toward healthcare and nurses conducted in the United States revealed that the public admires nurses and most people are willing to have an increasing portion of their care delivered by nurses. The image of nursing and the responsibility laid upon their shoulders have evolved through the centuries. First, we have the angel of mercy. This image grew out of the influence of Christian and Jewish religion and the risks inherent to the practice of nursing. Images of the angel nurse are usually serene and content with a halo or other religious symbols. Next, we have the handmaiden. This image portrays the physician as a male-dominant role. The nurse is a female who is merely an assistant. She plays a supportive role at the patient's bedside. Then there's the battle axe. In the 17th century, science and philosophy began to emerge. Religion started to fade away from the nurse image, and the nurse became that tough and no-nonsense torturer. The picture in the bottom right-hand corner is of Nurse Ratched. This was a movie called One Flew Over the Cuckoo's Nest. She is the epitome of the battle axe nurse. Finally, we have the naughty nurse. This is the image I'm sure we're all familiar with. Nurses, for as long as I can remember, were portrayed as sexy, airheaded women used as potential dates for physicians. In the 1900s, nurses were portrayed in military uniform, becoming the most influential factor to have shaped the nursing profession. This image began to improve the way nurses were seen by the public, fashioning the nurse as an integral part of the healthcare team rather than a mindless assistant. Florence Nightingale is noted as the founder of modern nursing, challenged previous traditions of mindless women as the doctor's assistant. Her understanding and use of evidence in practice helped develop the understanding of providing a clean environment for patients, thus improving their outcomes. Clara Barton is another important figure shaping today's nursing profession. She was an American teacher, nurse, and humanitarian who organized the American Red Cross after the Civil War. Today, it's one of the largest organizations to assist in disaster situations. Other famous nurses in history include Sojourner Truth, Harriet Tubman, and Lillian Wald, who was the founder of public health nursing. The student nurse's grandmother states, "In my day, girls became nurses to catch themselves a rich doctor for a husband." This statement is reflective of which image of nursing? The correct answer is B. The image of the naughty nurse puts a sexual connotation to the working relationship between male physicians and female nurses. The reward for being a good nurse would be marriage to a physician. Clinical judgment is the observation, comparing, contrasting, and evaluation of the client's condition to determine whether change has occurred. It also takes into consideration the health of the client and what is expected from the individual based on their specific medications, treatments, and condition. This process is collectively known as the nursing process. You will become more familiar with this as you continue your education and into your career. Nurses use clinical judgment every day as they apply their knowledge to various roles in patient care. Every action taken may potentially help or harm the patient. Critical thinking is a reflective thinking process that involves collecting information, analyzing the adequacy and accuracy of the information, and carefully considers options for nursing action. Nurses critically think every day and must be able to act quickly upon when a patient is in dire need of help or when multiple patients have various needs the nurse needs to attend to. Problem solving is a process by which nurses consider an issue and attempt to find a satisfactory solution to achieve the best outcomes. You will often use problem solving as a nurse and will notice that nurses make excellent problem solvers in their home lives as well. This is an overview of the nursing process. We will review this process later in the semester, but note that you will use the nursing process the rest of your nursing career, as it envelops critical thinking, clinical judgment, and nursing skills to care for the client holistically. Multiple attempts have been made to redefine the definition of nursing, but all have failed to articulate a more on-point explanation. Nurses have a wide range of roles and a wide range of settings. Some are very simple and some are very complex. In 2010, the ANA defined 5 characteristics of registered nursing. 1. Nursing practice is individualized. 2. Nurses coordinate care by establishing partnerships with patients, families, support systems, and other healthcare teams. 3. Caring is central to the practice of the registered nurse. 4. Registered nurses use the nursing process to plan and provide individualized care to the healthcare consumers. And 5. A strong link exists between the professional work environment and the registered nurse's ability to provide quality healthcare and achieve optimal outcomes. As a result of this, the ANA redefined professional nursing as the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. Nursing is a career that will forever be evolving as long as nurses' knowledge continues to increase. It is a strong foundation in science, but built with care and compassion. As students, you will see how nurses' roles change in various clinical settings. They must be flexible and competent to help patients in different aspects of care needs. This will also help you as the student to see where you best fit in the world of nursing. An article I read in American Nurse Today stated, "Nurses have specialized education and training validated by professional licensure in each state. We have a code of ethics and established practice standards we are bound to adhere to, a violation of which can result in a license being revoked or sanctioned. We have our own body of ongoing research that shapes and governs our practice. Nurses work autonomously within our scope of practice. We formulate and carry out our own plan of care for clients. We apply judgment, use critical thinking skills, and make nursing diagnoses." I think this is a pretty good definition of a nurse as a professional. When a nurse works outside of his or her scope of practice with disregard for ethical and critical thinking, they have crossed the line and should no longer be considered a professional. Unlike physicians, nurses are not in control of their own practice environment. Typically, nurses are hourly wage earners and are at the mercy of their employer. But Nurse Practice Acts, however, do not prevent nurses from working more autonomously. So what keeps nurses from becoming one professional unit? Several components might improve the status of nursing. One of them being standardized educational requirements for entry into practice. This would be making all entry-level nurses either ASN or BSN. Another one would be enacting uniform continuing education requirements. In Indiana, we do not require CEs for nurses unless they have certifications or specialties. 3 is encouraging the participation of more nurses in professional organizations. Nurses should look into their state councils. The Indiana State Nursing Association offers discounts for certification exams for their members. There are other many benefits, including those joining these councils. A lot of times they will give you free information about testing or improving your evidence-based care. Another is educating the public about the true nature of nursing. In recent years, nursing has been in the top 10 prestigious professions. Nurses have been doing a better job of standing up and illustrating the picture of a strong, intelligent person, smart enough to complete intricate tasks and kind enough to hold the hand of a dying woman while she takes her last breath. Nursing is driven by theory, and theory is driven by practice. Nurse theorists come about because of the need to know and question how effective nursing practice really is. Is the way we practice safe or effective, or is it outdated with room for improvement? Nurses started researching and creating better and more effective ways of caring for patients, thus improving patient outcomes. One factor that prevents nursing from being described as a profession rather than a job would be, and the answer is D. In general, healthcare facilities determine the work of the nurse will be. In most healthcare facilities, the organization dictates the work routine and what makes the nurse's daily functions. A profession is more autonomous in controlling the practice environment. Nursing education involves both formal and informal educational experiences. The initial education is formal, as you complete classes required for licensure. After this, nurses are required to complete some informal training. This usually is in the form of specialized training for a specific unit, certifications like CMSRN or CCRN. Nurses who complete specialized certifications must frequently then complete continuing education credits. As you see, there are 5 levels of entry into nursing practice. We will discuss these more in depth over the next few slides. Indiana acknowledges LPNs, or licensed practical nurses, and RNs, or registered nurses. LPNs are a 1-year technical degree, and several paths are available to obtain an RN degree from there. The first path is the diploma program. This is an apprentice-style program of learning. This is the oldest type of nursing training and focuses on clinical experiences and direct patient care. This type of training is quickly phasing out, and there are less than 69 of these programs still in existence today. The second path is the associate degree programs. Many community colleges offer this program, and the number of schools that offer them have increased slightly in the most recent years. These nurses are prepared for direct patient care upon completion of their education. The third path is the BSN, or baccalaureate degree. This is a 4-year degree with training in community nursing, managerial-style thought processes, and they're prepared to complete basic research. They're also ready to enter graduate programs upon graduation from this program. With that being said, there are many schools now offering RN to BSN programs, as the goal is to increase the proportion of BSN prepared nurses to 80% by the year 2020. Next, we have the MSN, or the Master's Degree Nurse. There are 2 paths for the MSN. The first path is for those students who have a bachelor's degree in another field of study and complete their studies in nursing within 3 years. They can then sit for the NCLEX RN, finishing with a master's degree in nursing. The other route for this degree is for an ASN or a BSN prepared nurse to complete the classes needed to be awarded an MSN in nursing. This track usually takes 2 to 3 years to complete, again, depending on the route of education. And finally, we have the DNP and the PhD. These 2 degrees focus on research and are parallel in the amount of education that a physician would obtain. Therefore, these nurses earn the title of doctor when completing their education. Patricia Benner was the one nurse theorist who described the process by which a nurse acquires clinical skill and judgment. Dr. Benner's approach to knowledge development that began with her work, Novice to Expert, constitutes commencement of a growing, living tradition for learning from clinical nursing practice through collection and interpretation of exemplars. Stage 1 is the novice nurse. These nurses have no background experience, therefore little direction to guide them through a situation. This is difficulty discerning through relevant and irrelevant aspects of a situation. Benner also suggests that a nurse of a higher skill level may be a novice again if put into an unfamiliar area of nursing or situations. One example of this is that the nurse completes a dressing change because she knows it needs to be done, but then forgets to address the pain prior to changing the dressing. The second phase of nursing is the advanced beginner. This phase begins when the nurse can demonstrate marginally acceptable performance, having coped with enough real situations to know, or to have pointed out by a mentor, the recurring meaningful concepts of the situation. The advanced beginner has enough experience to grasp aspects of the situations. These aspects cannot yet be objectified completely because they still lack solid experience based on recognition in the context of the situation. Nurses functioning at this level are guided by rules and are oriented by task completion. They still lack the larger perspective of the situation. The example provided states that the advanced beginner may be caring for a postoperative patient whose blood pressure has decreased, pulse rate has increased, and has become restless since surgery. The nurse knows to report the abnormal finding, yet cannot connect that this finding may indicate blood loss. The competent nurse is formed from the advanced beginner by learning from actual practice situations and following the actions of others. A sense of mastery is acquired through planning and predictability and usually is achieved within 2 to 3 years. The level of efficiency is increased, but the focus is on time management and the nurse's organization of the task rather than on timing in relation to the patient's needs. This nurse can now handle their patient load and begin to prioritize situations in greater ease. The competent nurse is most pivotal in clinical learning because the learner must begin to recognize patterns and determine which elements of the situation warrant attention and which ones can be ignored. Studies point to the importance of active teaching and learning in the competent stage to coach nurses who are making the transition from competency to proficiency. The scenario with the post-op patient now has a better chance because the competent nurse can connect the changes and vitals with the surgery, recognize early signs of shock, and conduct a more in-depth assessment. At the proficient phase, the nurse perceives in the entire situation rather just in pieces. Now the performer recognizes the most salient aspects and has an intuitive grasp of the situation based on background experience. Nurses at this level demonstrate a new ability to see changes and relevance in a situation, including recognition and implementation of skilled responses to the situation as it evolves. There is also more patient and family involvement at this time. Now, back to the post-op patient. The most proficient nurse will be able to look at the bigger picture and see that these symptoms the patient is having may be warnings of a heart attack, pulmonary embolus, or possibly even a stroke. Last, we have the expert phase. Now the nurse no longer relies on an analytical principle to connect his or her understanding of the situation to an appropriate action. Benner described the expert nurse as having an intuitive grasp of the situation and as being able to identify the region of the problem without losing time consideration, a range of alternate diagnoses and solutions. These nurses can rely on their intuition and expertise, and often are requested by other staff for their assistance or advice. Each state in the U.S. has its own Nurse Practice Act. These are the laws that regulate nursing practice and are composed and regulated by the state's Board of Nursing. The state board is responsible for approving nursing education programs, defining the practice of a professional nurse, establishing criteria that allows a person to be licensed as a nurse, defining professional practice, which determines the nurse's scope of practice, developing rules and regulations for nurses, and enforcing the rules that govern nursing. To become licensed as a nurse, the person must complete their formal education at an approved school of nursing and successfully complete the NCLEX exam. It is also important to note that if the nurse completes a task that is outside of their scope of practice, they may have to stand in front of the board to determine if their license to be revoked for a short time or even permanently. Standards of care or standards of practice in nursing are general guidelines that provide a foundation as to how a nurse should act and what he or she should and should not do in his or her professional capacity. Again, deviating from this standard can result in certain legal implications. The American Nurses Association sets the professional standards of practice, and all nurses need to be somewhat familiar with these guidelines. Which organization is directly responsible for regulating the practice of nursing in each state? The correct answer is A. The State Board of Nursing regulates the Nursing Practice Act for each state, and the ANA regulates the standards of practice. Prior to 1911, the Nurses Association alumni of the United States and Canada governed nursing practice. Now we have the American Nurses Association and the Canadian Nurses Association. When they were first established, focus was on creating nursing standards for quality care. Now these associations continually update standards to best fit the needs of current nursing practice. The ANA also publishes educational materials and research for their journal, The American Nurse. The NLN was founded in 1893 as the American Society of Superintendents of Training Schools for Nurses and was the first organization for nursing in U.S. In 1912, it was renamed the National League for Nursing Education and released the first standard curriculum for schools of nursing in 1917. The NLN sets standards for all types of nursing education programs, studies the nursing workforce, lobbies and participates with other healthcare organizations to set policy for the nursing workforce, aids in faculty development, funds research, and publishes the journal Nursing Education Perspectives. On a more global scale, the International Council of Nurses represents the more than 13 million nurses worldwide. They support global health policies and advance nursing and health around the world, as well as working to improve nursing conditions. There are multiple specialty nursing organizations in the United States that have been created for nurses that work in specialized nursing units and for those who have certain values in their nursing careers. Examples of clinical specialties include Emergency Nurses Association or Association of Pediatric Oncology. There's also one for hospice or palliative nurse associations, and many more. Specialties that are specialized by groups include the Coalition of Advanced Practice Nurses of Indiana, National Association of Hispanic Nurses, and the National Navy Corps. Then you have groups that identify by values. These can include Christian Fellowship Nurses and Nurses Without Borders. The National Student Nurses Association is the student nurse counterpart to the ANA. It is ran by elected officials who advocate on behalf of all nursing students. Most schools of nursing have local chapters of the NSNA. This organization also has their own journal, Image, dedicated to the student nurse issues. Then we come to the Sigma Theta Tau International. This organization publishes the Journal of Nursing of Scholarship. The STTI is an honor society for nursing students and was founded in Indiana. The first chapter was formed in 1922 at Indiana University. They are the second largest nursing organization in the U.S. One goal for nurses is to achieve health promotion. According to the World Health Organization, health promotion is the process of enabling people to increase control over and to improve their health. It moves beyond a focus on individual behavior towards a wide range of social and environmental interventions. So in essence, nurses promote health by teaching the patient how to take control of their health. One example of this would be if you are taking care of a diabetic patient, you're dressing their wounds, but you can talk to them about different ways to keep their blood sugars low, like exercise or diet. Another area would be preventative health care. This is also called primary care. These nurses are tasked with improving the health of patients through evidence-based recommendations while encouraging individuals to receive preventative services. This could be like screenings, counseling, and precautionary medications. Another example are childhood immunizations or the vaccine for preteens for HPV. Preventative healthcare encourages nurses to teach patients about regular exercise and weight management, smoking or drug cessation, moderate alcohol use, and control existing diseases. Remember, this is called primary care. Health restoration is the process of healing the body back to the baseline functioning prior to an illness or disease. One example of this is after an exacerbation of heart failure. The nurse helps, either in the hospital, community, or rehab setting, to teach the patient nutrition and activity guidelines, medication regimens, and when to seek care by the physician. This care is called secondary care. Another example of health restoration is if a patient or family want to join a cancer support group to deal with the emotional well-being of a patient. One piece of nursing that people don't like to discuss is end-of-life care. When a patient is terminal and no other interventions are possible to maintain life, nurses, along with other healthcare team members, collaborate to provide comfort to the patient and families of the dying. Although difficult for many, this one is of the many rewarding aspects of nursing. End-of-life care and rehabilitation are considered two different types of tertiary care. It's also important to know who is receiving care by the nurse. Ultimately, the patient or client is the person who is responsible for their own health. The nurse merely assists the patient in achieving their health goals. There are two types of care, direct and indirect. Direct care involves personal interaction between the nurse and the patient. This would be like giving medications, bathing, changing a dressing, or doing an assessment. Indirect care is when the nurse works on behalf of an individual, group, family, or community to improve their health status. It can also involve the duties that nurses complete during their day, such as restocking the crash cart, ensuring staffing, or serving on committees. The national economy has a strong influence on the U.S. healthcare system. Insurance has always been linked to full-time employment. As the economy began to decline over the past decade, unemployment rates increased, so that meant insured individuals began to decline sharply. For nurses, this means that people are waiting to come to the hospital until they are very ill. We are now seeing a trend of sicker patients entering the hospital. Patient acuity is on the rise and affecting nursing care. As far as healthcare consumers go, the population who are in greatest need of nursing care are those that are 65 and older. We must also take into consideration that the rate of growth of the younger population is not nearly as great. This is continuing the nursing shortage trend that we have seen over the past several years, and it's not going to ease up any. Another point to consider when it comes to the consumer is that now they have choices when it comes to healthcare providers. Patients are smarter about their health and have access to resources to which they can gain access to needed information. They demand to be participants of their care. That point leads us up to direct-to-consumer marketing. All this means is that businesses that sell medications and medical treatments are directing their advertising straight to the consumer now. They become very interested in the information and request that their primary care providers prescribe the new drug or surgery. But as nurses, we must help to educate the patient about the medication and identify any false information that they may be given. Legislation also influences the care nurses provide, in the confidentiality of patients' medical records, informed consent, and the patient's right to be dignified at their death. This topic will be covered in greater detail later in the semester, but I think that it's important to note that nurses have the potential to be very influential in shaping healthcare policy. This is due to the fact that we have the largest health professional group. If nurses chose to stand up for their rights as a collective whole, we would probably see more action taken in our favor with safe staffing needs, safe patient handling, and many more. Nursing has evolved so much from its roots. Unmarried women were at one point the only people to practice nursing. Having a family meant that you were forced out of the career to care for your family. Eventually, the women's movement allowed for more choice and greater career paths that were available to everyone. This is also probably the reason that nursing is mainly a female-dominated profession. Finally, we have collective bargaining. This is when the nurses negotiate for better wages and working conditions. Nursing unions are the only ones that usually do the bargaining, but they are not available in every state. Nurses who live in states with unions tend to be very happy with their jobs. I believe that today there are only 10 to 12 states that have unions for nurses. Complementary and alternative medicine, or CAM, are treatments or services outside of the traditional Western medicine. Medical systems such as homeopathy, naturopathy, chiropractics, and Chinese medicine and treatments such as aromatherapy, massage therapy, yoga, and hypnotism are popular CAM treatments today. It's important to ask patients what types of alternative treatments or herbs or medicines that they use outside of the physician's care and prescriptions for their illnesses or diseases. The amount of nurses that work in hospital settings is continuing to decrease. More nurses are working in outpatient and community settings, allowing for greater autonomy and giving them independence. But along with that comes the need to understand technology as it applies to healthcare and having a strong base of nursing knowledge so as to care for patients outside of their reach. On the flip side of this, though, nurses must also be able to keep true to their holistic view of patient care. Today, we rely so much on monitors and other devices that we tend to forget about the patient that's directly in front of us. The QSIN competencies are 6 areas of expertise that nursing students are expected to acquire before graduation. Each competency includes a list of associated knowledge, skills, and attitudes that operationalize the concepts. The first one is patient-centered care. We must recognize the patient or designee as the source of control and respected partner when providing care to the patient. The nurse must respect the patient's preferences, values, and needs when choosing treatment for them. 2 is teamwork and collaboration. Nurses must be able to function alone or as part of an interprofessional team. As a team, open communication, respect for each other and the patient, and decision-making come together for quality patient care. 3 is evidence-based practice. Nurses must integrate the latest research and best practice along with their own clinical expertise and patient wishes to provide best care for each individual patient. 4 is quality improvement. It seems to go hand in hand with evidence-based practice. This competency discusses the use of data to monitor outcomes of old care processes and methods to improve upon them. This is why we are seeing constant improvement in our patient care. 5 is safety. It's one of the biggest concerns in nursing and always will be. Simply put, this is how we monitor the risk of harm to patients and providers. We are nurses and we are always going to be looking for different ways to improve safety. 6 is informatics. This has been a growing trend in healthcare in recent decades. Informatics is the use of information and technology to communicate, manage knowledge, mitigate error, and support decision-making. Several years ago, the electronic charting systems were all the rage. We transferred all of our paper documentation to computers, and now we are looking at how we can create interoperability between the hundreds of systems that are out there today. So, does anybody know what competencies Flo demonstrated? I look at them as patient-centered care, teamwork and collaboration, and quality improvement. She was beyond her time in very many ways. North American healthcare typically reflects that of the European culture. The services provided in North America are comparable to those of highly developed European countries. Hospitals are most frequently used and most expensive site for patient care. There are many services that the hospital can provide and illnesses that are treated there. They also vary in size and capabilities. It's estimated that more than 60% of RNs are employed in hospitals. Extended care facilities, as you can see, cover a broad range of facilities. Typically, care in a facility of this capacity is longer than a normal, sometimes even more than a month due to changes in hospitalization and insurance. Skilled care services are usually found in the nursing home or rehab facilities, and much like a subacute hospital, they offer IV therapy, rehab, and extended treatment for certain illnesses. Custodial care consists of help with activities of daily living, such as bathing, dressing, eating, grooming, ambulation, toileting, and treatments such as help with medications, vital signs, and more. Nursing homes provide care for people who are not able to live on their own. They may need long-term assistance with treatments but are not sick enough to be in the hospital. Typically, these people are permanent residents of the facility. Rehab centers offer care to those needing extended treatment with rehab from drugs or alcohol, or facilities for physical rehab. This can be for people with injury from stroke, motor vehicle accidents, or other traumatic injuries. Typically, rehab centers work with interdisciplinary groups such as doctors, therapists, psychiatrists, pharmacists, nurses, CNAs, and all of these people working together ensure quality care. Assisted living centers is a sort of bridge for people who are not quite ready for the nursing home but have some difficulty with ADLs that keep them from functioning well on their own. An example of this would be a diabetic who can perform most activities by themselves but may need help with preparing meals or no longer can administer his own insulin. Ambulatory care centers are most cost-effective healthcare facilities that provide a lot of the same services as an emergency department. They are also available in many cities. One example in our area has become very popular is MedExpress. Home healthcare agencies are a great option for people who wish to become to keep people at home or people that are terminally ill. A lot of times, though, people are unable to provide all the services that the patient may need. Community or public centers are designed to provide health strategies to the public at large. For example, at a center like Planned Parenthood, they are providing care to the at-risk youth, thus improving their health status. Independent living facilities are more like neighborhoods for seniors 55 and older who do not want the responsibility of home ownership and provide a sense of community for those who live there. In areas like this, nurses usually provide periodic health screenings and health teaching when needed. Be familiar with the different people in the interdisciplinary team and what role they play. Nurses work a lot with different professionals in the healthcare interdisciplinary team, but one that should be mentioned are the nursing assistive personnel. They are a wonderful asset to the healthcare team. One concern, though, is that nurses often rely too heavily on information gathered by the nursing personnel when making patient care decisions, one example being accurate vital signs. How often do we see nurses rechecking blood pressure if the patient has a high or low blood pressure? This is very dangerous if a medication is being given and maybe the blood pressure is inaccurate. Note that if we use electronic machines, which very many hospitals and facilities now have, the blood pressure may be inaccurate if the heart rhythm is irregular.